Can vitamin B12 supplements cause diarrhea? And if they can, how do you know whether it's the vitamin itself or something else entirely? Before we dive in, just a quick note. This video is for general information only and isn't a substitute for advice from your GP or pharmacist. If you have concerns about your health, always speak to a healthcare professional. Right, so vitamin B12, also known as cobalamin, is a water-soluble vitamin your body needs for red blood cell formation, neurological function, and DNA synthesis. It's essential, and when levels are low, treatment really does matter. The good news is that most people tolerate B12 supplementation very well, even at higher doses. Because it's water-soluble, any excess is simply excreted through urine rather than building up in the body. That said, diarrhea is listed as a rare adverse reaction in UK product information for both oral cyanocobalamin tablets and injectable hydroxycobalamin preparations, so it can happen, it's just not common. Here's something important though. When digestive symptoms do occur, the vitamin itself is often not the main culprit. Many B12 supplements contain additional ingredients called excipients, things like sorbitol, mannitol, or lactose, used as fillers or sweeteners. These can cause osmotic diarrhea in some people, particularly those with lactose intolerance or sensitivity to sugar alcohols. So the tablet formulation may be the issue rather than the B12 itself. If you think this might apply to you, ask your pharmacist or GP about switching to a preparation without those excipients. They're well placed to help you find a suitable alternative. It's also worth thinking about what else might be going on. Some medications commonly used alongside B12 treatment, such as metformin for type 2 diabetes or proton pump inhibitors like omeprazole, can themselves cause gastrointestinal symptoms. Antibiotics are another common cause of loose stools that can coincide with B12 supplementation. If you've recently started or changed any of these, that timing is worth mentioning to your doctor. There's also the possibility that an underlying condition is involved. Conditions like celiac disease or inflammatory bowel disease can affect the gut and may actually be part of the reason B12 levels are low in the first place. NICE guidance emphasizes investigating the underlying cause of B12 deficiency, not simply treating the deficiency in isolation. A few practical points. If you're taking oral B12 tablets, taking them with food may help reduce any stomach upset. If you're on prescribed injectable hydroxycobalamin and you're experiencing symptoms, speak to your GP before making any changes. Don't stop a prescribed treatment without advice. And it's always worth reviewing all your current medications with your doctor, particularly if you're on metformin or a proton pump inhibitor. Now, when should you seek medical advice more urgently? If diarrhea persists beyond 7 days, that warrants a GP review. Contact your doctor or NHS 111 promptly if your stools contain blood or mucus, if you have a fever alongside the diarrhea, if you're experiencing severe abdominal pain, or if you've had unexplained weight loss. These are red flag symptoms that need proper investigation. And if you ever experience signs of a severe allergic reaction, such as difficulty breathing, swelling of the face or throat, or a sudden rash, call 999 immediately. To recap, diarrhea is a rare but listed side effect of B12 supplementation, though it's more often linked to the excipients in the supplement than to the vitamin itself. Other medications and underlying health conditions can also be responsible. If symptoms persist or concern you, always speak to your GP or pharmacist rather than guessing. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, please give this video a like and subscribe to the Bolt Pharmacy channel for more straightforward health information.